your research and your work using intelligent medication solutions around the opioids. Obviously a hot topic here in the U.S. healthcare system and globally as well. But maybe you can just give a 1-minute overview on yourself and what you do at Children's.
I'm a pediatric anesthesiologist and a pain physician here at Seattle Children's Hospital and the University of Washington. I'm also a public health researcher focused on the opioid use and opioid epidemic as it affects adolescents. We're all familiar with the opioid epidemic in the United States that affects adults, and we know that there's been overprescribing of opioids to adults. Pharmaceutical companies have played a role in that, but also physicians. But that's really focused on adults. In adolescents, though, no one has ever really overprescribed opioids to them. They didn't go to these pill mill clinics or the chronic pain clinics. But what happens with adolescents is they get introduced to an opioid after surgery or after trauma. They get prescribed a certain amount of opioids. They usually don't use them all, and then they have a large amount left over at home. And then in future, then misuse those leftover opioids. Our research is focused on understanding what happens after an adolescent gets their first opioid prescription. We use electronic medication adherence device from a company called Information Intermediary Corporation. After knee surgery in adolescents, we have them place their opioids in this container. And then we can really closely track their opioids and know exactly when they're taking them sort of over the first 2 weeks after surgery. And then we follow up with them again at 2 months, 6 months, and 12 months and ask them about further opioid use or opioid misuse. And at the same time, while they're using the opioids, we're also asking them every 4 hours what their pain is doing, how their stress levels, about their mood, physical activity. Also, we ask them about history of substance abuse and related factors.